So doctors, good evening everyone. So doctors, we have a poor farmer today which came to our university hospital, and he had complained that some of his goats were unthrifty and they had pale mucous membranes. So what could this tell us? Like, pale mucous membranes could mean that it's anemic, right? So basically, if you consider our options, we could maybe think that it's Haemonchus, or it's Theileria, or it's Trichostrongylus infestation in the goats. So doctors, please explain more and let us know what you think.
Basically, all these three are gastrointestinal parasites, and one of it, the Theileria, is the blood parasite. The Haemonchus contractus is also known as barber worm pole. It lives in the abomasum, same like the Trichostrongylus, but it lives in the small intestine, and the Theileria, their blood parasite, can be found in the white blood cell and the red blood cell. Okay, can I know more about the sample collection, Dr. Nabina?
Alright, so for the sample collection, definitely we have to take both fecal and also the blood collection. So for blood collection, you get it from the jugular vein of the animal, and then by using a 18 to 21 gauge of a needle, and then just put it into a EDTA tube for anticoagulant and send it to the lab to make a thick smear or a thin smear. And then for the fecal sample, after collecting a very fresh sample from the goat, you put it inside a container which is a leak-proof container, so that it's not contaminated. The fecal inside is not contaminated, and send it to the lab. So the next.
Okay, so the most commonly laboratory tests performed to check for the Haemonchus contractus species are the fecal smear, the McMaster egg counting technique, the lava culture, the fluorescein labeled peanut agglutinin test, and the PCR. Among all these tests, the PCR is the most rapid. However, it is most expensive as well. For the larval culture, it will check for the identification of the larval stage number 3 to ensure that the tail and the head and the sheath it match the Haemonchus contractus species. Okay.
Next will be Trichostrongylus. So Trichostrongylus has actually 4 tests. Fecal smear to see the eggs, McMaster egg counting to count the amount of eggs inside, fecal culture to see the worm itself, and PCR. PCR is a reliable and expensive test. When you see the eggs, it's much larger than Haemonchus, and it's thin-shelled, colorless. McMaster egg count, usually in heavy infestation you can see 2,000, while in moderate ones you will see about 500 to 500 and above. In fecal egg culture, you will see the worms, which is a simple neck with no buccal cavity, and you can see the active peripore with no missing oval flaps in females. Next, I will pass it on to.
Okay, Theileria is a blood parasite, so it won't use fecal sample and it use a blood sample to make a thin blood smear or Ginsa's thin blood smear. So, in the blood smear, if it is positive, you can see schizone in the white blood cell or pyroplasm in the red blood cell. So other than that, you can use serology tests, which is the most commonly used is the ELISA and indirect fluorescent antibody test. So for ELISA, if it's positive, the color will change, and it's the same with indirect fluorescent antibody test. And if it's negative, the color won't change. But to carry out serology tests, you have to confirm the species of the parasite before you can proceed and get an accurate result.
So thank you very much, doctors, for your sample collection explanation as well as your lab results and explanation of the parasites. You can be dismissed. So now I'd like to call upon our experts on the treatment and prevention to educate our farmers further. So thank you.
Hi, good morning. I'm Dr. Lim. Together with my colleague, Dr. Hawa, we're going to explain how do we treat this case. Since our goat is suspected parasite infestation, so you must have one treatment plan in mind. So in terms of blood parasite, you might probably need to consider tetracycline class, precisely oxytetracycline, because it's quite effective towards blood parasite. And then another blood parasite which is quite common in goat, it is eperithrozone, which is also Mycoplasma ovis. it causes aperitural zoonosis in goat. You can use also tetracycline class of drug, but you can use doxycycline. For PGE caused by Haemonchus that we suspected just now, we can use the class salicylanidates, which we commonly known as closentel. It is very effective against the Haemonchus by depleting the ATP production of the bone. For the next treatment, Dr. Hawa, would you like to add?
Yes, of course. Although chested and traumated is not in our case, but we suspected this also will affect this case. So like liver flare, we can treat by salicylanidates and benzodiazepine. That's all from ours, right?
Yeah, I think we need to consider how do we prevent this parasite from our goat. So we got another expert from the farm to control our parasite infestation, Mr. Azahar.
Okay, my name is Mr. Azahar, and my partner here is Iskandar, and we will continue with the prevention and control. Okay, I will start first. Usually this kind of farm animal will having problem in a herd. So in order to overcome any problem, we will have to have the treatment strategies, which can be divided by three. Which is the first one is the tactical, savage, and selective treatment. Okay, for the tactical one is that we have to plan in this certain conditions such as the hot or raining. We have to have a better timeline for the animal to grazing, because as an example, in moisture condition there will be increase in egg counts in the grazing area. And for the savage, it is a treatment for usually the infected animal. And for the selective is we will select a certain animal to be treated so that we will not waste the cost for treatment for the other animals. And the others is the sanitation, which includes the food through and water through, and also the house design. So I will pass to Iskandar to continue.
Now I will continue about pasture and soil management. So basically, this pasture and soil management is designed to prevent the internal parasites for long-term planning. Okay. Animal density is also play a role in order for the animal get infected. For example, overpopulation can increase the concentration of the parasites. Then pasture rotation or intensive grazing can be practiced in the farm so that there will be no parasite to get into the animal. And also grazing height and time. So the recommended grazing height for the grass is letting the animal graze only 10 cm from the ground in a field where there are parasites. And also the grazing time is within 11 a.m. in the morning until 12. And then resting the land to clean up the land from parasites egg, and also amendment, which we can enforce or do a law, and fertilizer. Okay, and also the last one is health management. So basically, for the diets, vitamin A, D, and B complex are the most important vitamin required by animals to develop resistance to internal parasite. According to Lepage, animals should be fed from the feeder directly from the ground to avoid contamination as a result of their milk coming into contact with manure or bedding, which has parasite. And lastly, all new arrival to the herd should be quarantined for at least 4 to 6 weeks and deworm if there is any doubt. Thank you. That's all from us.
Well, thank you to our experts here from MH. I'm sure that our farmers will be really awesome. Thank you.